Hey everyone, and welcome back to Channel Health and Alerts. I'm excited to be talking to you today about a topic that affects us all at some point, stomach aches. We've all been there, right? That uncomfortable, sometimes downright painful feeling in your gut. But here's the thing, a well-informed person is more likely to survive longer and have a better quality of life than an uninformed one. That's why I created this channel, to empower you with the knowledge you need to take control of your health. So if you're ready to understand the common causes of stomach pain and what you can do about them, hit that subscribe button and let's dive in. Let's talk about gastritis. Your stomach is a tough cookie. It produces strong acid to break down food, but sometimes this acid can irritate the stomach lining. That's gastritis. Think of it like a little fire in your belly. Several things can trigger it: nasty bacteria, pain relievers, too much happy hour, or stress. The good news is gastritis can often be treated with antacids. Sometimes you might need prescription meds. If you think you have gastritis, get checked out by your doctor. Now let's talk about peptic ulcers. These are like little sores that develop on the lining of your stomach or the upper part of your small intestine. Ouch, right? And the usual suspect is bacteria, but hold on. Those pain relievers we talked about earlier, they can also be a factor. And if you smoke or drink a bit too much, you're also putting yourself at a higher risk. Now here's the good news. Peptic ulcers are treatable. Your doctor might prescribe medications to reduce stomach acid, or if bacteria are the culprit, antibiotics. The key is to get diagnosed and treated early. Remember, your health is your wealth, so invest in it. Okay, we've all been there, the dreaded stomach flu, or as doctors call it, viral gastroenteritis. It's incredibly contagious and it hits you like a ton of bricks. You know the symptoms: watery diarrhea, cramps that make you double over, nausea, and sometimes even vomiting. It's no picnic, that's for sure. You pick it up from other people or contaminated food, so wash your hands, people. Now, there's no magic cure for this one, just time and rest. Your body needs to fight off the virus. But here's the thing, if you have a fever, can't keep anything down, are super dehydrated, or, and this is important, see blood in your vomit or stool, get to a doctor ASAP. Food poisoning, it's the unwelcome guest at any meal. You know, the feeling, nausea, vomiting, and diarrhea that seem to come out of nowhere, and the culprit, usually bacteria, viruses, or parasites lurking in food that wasn't handled properly. Now, most of the time, food poisoning is like a bad storm, unpleasant, but it passes. However, if you're severely dehydrated, think dry mouth, dizziness, weakness, see blood in your vomit or stool, or have diarrhea that's hanging on for dear life after 3 days, it's time to call your doctor. And listen up, folks, if you have any other health conditions or a weakened immune system, don't mess around with food poisoning. Get checked out right away. Let's talk about a condition that affects millions: irritable bowel syndrome, or IBS. It's a common disorder that affects your large intestine, causing cramping, bloating, and that uncomfortable feeling of needing to go but not always being able to. The exact cause of IBS is still a mystery, but certain foods, stress, hormones, and past infections can play a role. The good news is that IBS is manageable. Your doctor can help identify triggers and develop a treatment plan. Raise your hand if you've ever felt a little off after a big glass of milk or a cheesy pizza. You might be lactose intolerant. Lactose is a sugar in milk and dairy products, and some of us lack the enzyme lactase to break it down. The result? Gas, bloating, and stomach cramps. Try lactose-free dairy products. They've come a long way. Or take a lactase enzyme supplement. Your gut will thank you. Chapter 7. Pelvic Inflammatory Disease, a wake-up call. Ladies, this one's for you. Pelvic inflammatory disease, or PID, is an infection that affects your reproductive organs. It's usually caused by sexually transmitted infections like chlamydia or gonorrhea, and it's nothing to mess around with. Now, besides stomach pain, PID can cause fever, unusual discharge, and pain during sex. The good news is that if caught early, PID can be treated with antibiotics. But here's the catch: if left untreated, it can lead to serious complications like infertility. So listen to your body, and if you experience any of these symptoms, see your doctor right away. Chapter 8. Food allergies, when your body declares war. Food allergies. They're more than just a mild inconvenience, they can be life-threatening. It's like your body mistakes a harmless food for a dangerous invader and launches a full-on attack. Think tingling and swelling in your mouth and throat, hives, stomach cramps, vomiting, and in severe cases, a life-threatening allergic reaction called anaphylaxis. Common culprits include shellfish, nuts, fish, eggs, peanuts, and milk. If you know you have a food allergy, you know the drill. Avoid it like the plague and carry your epinephrine auto-injector, like an EpiPen, with you at all times. And if you suspect you might have a food allergy, see your doctor for testing. Chapter 9. Appendicitis, don't ignore this pain. Let's talk about the appendix. It's that little finger-shaped pouch connected to your large intestine, and honestly, we're not entirely sure what it does, but when it gets inflamed, it's called appendicitis, and it's a medical emergency. Appendicitis typically starts with pain around your belly button that eventually moves to the lower right side and intensifies. You might also experience nausea, vomiting, loss of appetite, and fever. If you suspect appendicitis, don't wait. Head to the ER immediately. A burst appendix is a serious situation. Your gallbladder is like a small sac that stores bile, which helps you digest fats. But sometimes these substances can crystallize and form gallstones. And when a gallstone blocks the bile duct, you get a gallbladder attack. Not fun. The most common symptom is intense pain in your upper right abdomen, often after a fatty meal. You might also feel nauseous, vomit, and experience fever. Now, most gallstones pass on their own, but if the pain is severe or lasts for several hours, call your doctor. In some cases, surgery might be needed to remove the gallbladder, but hey, you can live a perfectly healthy life without it. A hernia happens when an organ pushes through an opening in the muscle or tissue that holds it in place. Think of it like an internal bubble. Now, usually hernias are harmless, but sometimes they can get twisted or trapped, cutting off blood flow. That's called an incarcerated hernia, and it's a surgical emergency. You'll experience sudden severe pain in the affected area, along with nausea, vomiting, and the inability to pass gas or have a bowel movement. If you suspect an incarcerated hernia, don't hesitate. Call 911 or get to the ER immediately. We've all been there, that feeling of being backed up. Constipation is super common, and it's usually not a big deal. But if you're struggling to go more than 3 times a week, straining like you're lifting weights and your stools are hard and lumpy, it's time to take action. The good news is that simple lifestyle changes can often do the trick. Up your fiber intake with fruits, veggies, and whole grains. Drink plenty of water. Think of it as lubrication for your digestive system. And get moving. Exercise helps stimulate bowel movements. But if constipation is a regular thing for you, talk to your doctor. There might be an underlying issue that needs attention. Your pancreas is a vital organ that helps with digestion and blood sugar regulation, but when it gets inflamed, it's called pancreatitis, and it can range from mild to life-threatening. The most common symptom is pain in your upper abdomen that radiates to your back and worsens after eating. You might also experience nausea, vomiting, fever, and rapid heartbeat. Mild cases of pancreatitis often clear up on their own with rest and fluids. But if the pain is severe or you have other symptoms, head to the ER. Severe pancreatitis can be a serious condition. Inflammatory bowel disease, or IBD, is a group of disorders that cause chronic inflammation in your digestive tract. The 2 main types are Crohn's disease and ulcerative colitis. IBD can cause a whole host of unpleasant symptoms, including persistent diarrhea, abdominal pain, cramping, rectal bleeding, weight loss, and fatigue. While there's no cure for IBD, there are effective treatments that can help manage symptoms and improve your quality of life. If you're experiencing any of these symptoms, don't brush them off. See your doctor for a proper diagnosis and to discuss treatment options. Diverticular are small, bulging pouches that can form in the lining of your digestive system, most commonly in your colon. Most people with diverticular don't have any symptoms, but when these pouches get inflamed or infected, it's called diverticulitis. Symptoms can range from mild abdominal pain and cramping to more severe issues like fever, nausea, vomiting, and rectal bleeding. If you suspect diverticulitis, see your doctor. Treatment typically involves rest, a liquid diet, and antibiotics. In some cases, surgery might be needed to remove the affected portion of the colon. So there you have it, a rundown of some common causes of stomach pain. Remember, this video isn't a substitute for professional medical advice. If you're experiencing persistent or severe stomach pain, it's always best to consult your doctor to get a proper diagnosis and discuss treatment options. After all, you know your body best. Take care of yourselves, and remember, reset health, reset life. And don't forget to share this video with your friends and family. Sharing is caring.